Thank you, Sages, for the opportunity to present our research. The title of our project is Correlating Actual 1-Year Weight Loss with Predicted Weight Loss by the MBSAQIP Bariatric Surgical Risk-Benefit Calculator. None of the authors have any conflict of interest to declare. Obesity is one of the most significant health challenges faced today, and this has led to an increase in number of bariatric surgeries performed in the United States. Recently, the American Society for Metabolic and Bariatric Surgery, ASMBS, has released a Bariatric Risk-Benefit Calculator, or the MBSAQIP calculator, an online tool in which patients and providers can input patient preoperative information and predict a 30-day complication risk as well as 1-year weight loss. The database was built using data from more than 775,000 operations from 925 medical centers participating in MBSAQIP from January 1st, 2013 to June 30th, 2018. In this study, we validated our institution's bariatric surgery 12-month weight loss outcome data with a national database. Furthermore, we investigated patient factors that influenced lack of treatment effect after bariatric surgery. A retrospective review of all prospectively collected data of bariatric surgeries performed at Yale New Haven Hospital from January 1st, 2017 to December 31st, 2018 was conducted. Demographic data was recorded that included age, sex, race, ethnicity, preoperative BMI, functionality, comorbidity, insulin dependency, procedure, laparoscopic sleeve gastrectomy or gastric bypass, and BMI at 12-month follow-up. Patients undergoing conversion procedures who were younger than 18 years old and those with incomplete data were excluded. Two of the authors entered each patient's data into the MBSAQIP calculator, and the 1-year predicted BMI was calculated and compared to the weight loss actually experienced by the patients at 1 year. All measurements of BMI are in kilograms over meters squared. Statistical analysis was performed using unpaired t-test with Welch's correlation. Data was obtained from 848 patients who underwent bariatric surgery from January 1st, 2017 to December 31st, 2018 at Yale. Of those, 327 patients had at least 1 year follow-up. There were 94 or 28.7% laparoscopic gastric bypasses and 233 or 71% laparoscopic sleeve gastrectomies. The average BMI at 1 year follow-up was 33.6 with a standard deviation of 6.8, and the predicted BMI was 31.5 with a standard deviation of 6.8. The average difference between the actual and predicted weight loss at 1 year was 3.6 BMI points. There was no significant difference between the actual compared to predicted weight loss. Figure 1 displays a scatter plot of actual compared to predicted BMI at 1 year. The coefficient factor is 0.6 with a p-value of 0.003. This resembles a high correlation of weight loss data between our institution and that of the national database. Figure 2 shows a bell-shaped distribution of actual weight loss plotted against predicted BMIs. We found that 74 or 22.6% patients had greater than 5 BMI points above predicted, and 12 patients or 3.7% had less than 5 BMI points compared to the predicted. We extrapolated these 86 outliers with a comparison of weight loss for those patients whose BMI fell within 5 points of the predicted versus those whose BMI recorded above 5 points. Figure 3 reveals that those patients who did not respond as well to bariatric surgery, i.e. had higher than 5 BMI points than predicted, had significantly higher preoperative BMI, 46.1 versus 43.6, with a p-value of 0.008. In this study, we employed the World Health Organization obesity classification with Class 1 obesity classified as BMI of 30 to 34.9, Class 2 BMI 35 to 39.9, Class 3 BMI 40 or greater. Patients with BMI 40 or greater are not well categorized or defined in literature. They are further classified in this paper as Class 4 obesity with BMI of 50 to 59.9 and Class 5 obesity with a BMI greater than 60. In our conclusions, the MBSAQIP calculator is a useful tool to guide surgeons with decision-making and informed consent. Our results demonstrate that MBSAQIP risk-benefit calculator can serve as a standard by which program outcomes can be measured. Furthermore, our institution's one-year weight loss data correlated closely with that predicted by the calculator, validating its use in our patient population. When the 86 outliers from Figure 2 are examined, we found that patients who did not meet the predicted weight loss had significantly higher preoperative BMI, 46 versus 43.6, with a p-value of 0.008. This finding is corroborated in multiple other studies. This finding may alter preoperative discussions with Class 3 or above obesity or BMI 40 plus patients in regards to expected weight loss after surgery. This may warrant further investigations with the MBSAQIP to develop modifications of the calculator for patients who belong in the Class 3 or above obesity. In addition, with this validation of the calculator in our population, further studies can be performed to compare expected weight loss between primary bariatric procedures to the outcomes after conversions. And these are our references. Thank you very much.